Good morning and welcome to Module 1. In Module 1, we'll be talking about chapters 1, 2, and 4. This here is kind of a brief list of the things that we'll be covering in the slides. We're going to talk about the nurse's role in health assessment. What is health assessment? Talk about evidence-based practice, the nursing process, and that's going to be a big one. While you guys are preparing for class, I would certainly look over that. The types of assessments, the health history and the interview, therapeutic communication, objective versus subjective data. I would look over that pretty heavily. Documentation, the different types of documentation, and the patient medical record. This week, the only assignment you have to do is going to be the syllabus quiz. Today is Sunday, and I should have that posted today. There is an online lecture for you guys to watch. And remember, that lecture is going to be in the slides, so you'll be able to go in there and when you open up the slides, it'll be it's recorded in the slides. So just kind of go through that this week. Make sure that you join, that you get your book, your digital book, your course point, and go under, I think it's the Start Here section, and go ahead and join the class. And then make sure that you join iClicker, so that when we start class in a few weeks in person, you'll be able to check in and do your role, and then be working on getting ExamSoft if you don't already have it. Remember, the instructors have to have their classes posted by the 9th, because Miss Linda is going to go ahead and start enrolling everyone into ExamSoft. And our test is the first one at the end of the month, I believe. Don't quote me on that, though. So I want to make sure everybody's good and ready to go for that first exam. So this is going to be a little brief thing that I'll do every week. I will give you guys an update on what you have coming up, and I will talk about some key points that are going to be in the lecture, either if it's a live lecture or not, and just some reminders, so some housekeeping. And we're going to go over some sort of study technique each week. So this is completely optional to watch, but I thought I'd add it this semester because nursing school is difficult. We test differently. It feels like you are doing 45 different things in a week at the same time, and it can be overwhelming. So a friend of mine is getting her doctorate, and she said one of the things she loved that her instructor did was she did a little video every week and gave them some encouragement and gave them some tips. So I'm going to do the same thing, and we'll see how it goes. And if you guys like it, let me know. If you're like, you're really wasting your time, Dr. Ellen Jones, you don't need to do it. Just keep going about your Sunday. Let me know that. I've got a quote for you guys. I meant to put it in a slide, but I didn't. But here we go. Learning is never done without error and defeat. So I want y'all to keep that in mind as we start the semester. It's going to be different. Nursing school is just going to be different than your first 2 years, but you're going to be fine. The plan and the road that you're given, the plan and the journey that you may have written out may not be the plan and journey that you end up with, and it's okay. I promise you this, in all my years of nursing, no one has ever asked me what classes I failed. No one has ever asked me what grade did I make in concepts. No one has ever asked me what my GPA was or if I graduated with honors. They just want to know, can I come to work? This is a journey. Some skills you will master, some skills you will leave out of here and you'll be like, I don't even know how to do them. And that's fine. You don't have to be knowledgeable of every teeny tiny thing. You need to know the very, very, very important things, and those are going to be those top things that are going to be on the NCLEX. And we'll tell you, they always ask this on the NCLEX. And then you need to know where to find it. And you need to know that in nursing and in nursing school, you're not alone. You're never going to be by yourself. You're never going to be somewhere crazy where you're expected to perform open heart surgery all of a sudden by yourself. So keep those things in mind when things get overwhelming. Keep those things in mind when the grades didn't come out exactly how you wanted. 74 equals RN, because that means you know 74% of the material, which is a lot. It's enough to keep somebody alive. So do your very best. Reach out to instructors. Be active listeners in class. Talk to some of the students from the past, the students that sit up front, the students that engage, the students that are looking at the instructor, the students that participate, the students that are not on their computer working on classwork for another class are going to be the students that are going to have the better understanding of material. They're going to be able to recall the material and apply the material better. So make some goals for yourself this week while things have not quite kicked out, and decide what you want to do. When I was in nursing school, my goal was my very first semester, I would make sure that I was an active listener and I sat up front and I looked at my instructor, and I wanted to make sure that I felt confident in what I knew. Now, not confident in all the material, but I felt confident in what I knew. And if I felt like I did a good job, then I would let myself go on. But if I felt like I was skirting by and I didn't, then I was going to repeat. And I worked really hard on that, and my instructors noticed. And I knew 74% of the material, and I knew what I knew. Make sure that you schedule time for rest. Make sure that you schedule time for fun. You're still a college student. You're not going to have quite as much free time as you had before, but there are periods of time where you will. My door is always open. I'm 174. I'm not going to say I'm great at it, but I'm fairly good at helping time block a day. So if you find that you are overwhelmed, or you don't have time for a bunch of stuff, or you just don't know where to start, come by. Miss Kayla Jackson, who you'll meet as a success coach, is wonderful, and then anyone is wonderful. I'm so sorry. That is my dog in the background whining, and I don't know why, because I have let him out for an hour already. So he'll probably be doing that the whole time, and I do apologize. Okay, so let's get to what you came for. Well, okay, apparently I have the same slide on here twice, so. All right. We're going to talk today about multiple choice questions. So, let's talk about the parts of a multiple choice. My slides are not doing what they need to be doing. Okay, let's talk about understanding the parts of a multiple choice question. So when we have multiple choice questions, we have the question itself, which we call a stem. And so that's going to give us, that's the question, or it may be a statement or something of that nature. Then we have, I can't see my stuff. Hold on. Bear with me, y'all. I'm sorry. Okay. Like, where are my notes? Okay. I'm just going to do this. Hush, Simma. I made myself some notes in here. I can't see them, so we'll just do it like this. All right. Well, where the heck are my notes? Canva's about to make me upset. All right, we'll just close that out. I'll give it. Oh, Lord, now I done broke it all to pieces. Okay, go over here. All right. So, Sorry the screen looks like this. I'll figure it out for the next time. Okay, so the entire multiple choice question is called an item. So the question and the answers are the item. You've got the question part, that's the stem. And then you've got the second part, which is going to be your options or your responses. In those responses, we've got a couple of things. We've got distractors, which are not right. And then we've got the correct answer. When we're reading questions, we want to make sure that some questions are read in a certain way and some questions are read in others. And we'll talk about those as we go along. So those are the parts. So let's talk about a complete stem. So this type of stem is a complete sentence. The stem clearly and concisely formulates the problem that can be answered before you read the options. So when I was in nursing school, if I came across a question and I saw it was a complete sentence, we took paper test on paper because I'm old, but I'd cover up my answer choices. I'd read the question, I'd think about it, and I would answer it, and then I'd find an answer choice that matched what I picked, and I moved on. So if you see a question and it's got a period at the end, a question mark at the end, it is a complete sentence, a statement. Read that, stop, take a moment, see if you can decide what the answer is, and select the one that matches yours closely, and then move on. Then we have some that are incomplete stems. So these may have a colon at the end. They may have a comma at the end. They just may have nothing at the end. They don't have any kind of punctuation to make it a complete sentence itself. So these, you're going to have to read all the answer choices to know how to answer it. So when you read them, you may want to read it like, the most important reason why nurses should teach people not to smoke in bed is because it can upset a family member. Okay? Well, I don't know about that. Then start at the top again. The most important reason why nurses should teach people not to smoke in bed is because it can precipitate lung cancer. Okay, that's true, but that can be true if they smoke anywhere. And then read the question, read your stem again, and then read each option with your stem and think about it, and then move on to the next. So this correct answer is, the most important reason why nurses should teach people not to smoke in bed is because it can result in a fire. So one thing about nursing questions, and we'll talk about this in a couple of weeks, is sometimes all the answers are right. So all of these answers are right, but this one's got some keywords in it, most important. So even though we're not focusing on that today, look for those words that tell you exactly what you need. So this one is not reasons people should not smoke in bed, but this is the most important reason. Well, because it can catch their bed on fire. Yes, it can cause lung cancer. Yes, it can upset somebody. And yes, it can trigger a smoke alarm. But none of those are most important, most pressing, that would hurt the patient while they are actively in the bed in this moment. So start learning to look for those other types of words, those most important, the top priority, things like that. And I think next week we'll cover like important words or words that guide you. And so we'll see that a little more. Let's talk about polarity of a question. So a question can be positive or negative. So this one says, I'm go back. So a positive polarity question is going to focus on the positive. It's going to be looking for the truth. So you know, as soon as you see a question like this, you're looking for something that is the truth. It is a true statement. So an older adult who is dying starts to cry and says, I was always concerned about myself first, and I hurt many people during my life, which is the underlying feeling being expressed by the client. So this is a positive polarity question. And I'll show you on the next slide how to differentiate that between a negative. But this is a positive polarity question, and it is looking for which one of these is true. So are they ambivalent, sad, anger, or guilty? Well, they're feeling guilty. And so this is also one of those questions that's a complete question, a complete stem. So when you read through this, you may be able to cover up those four choices and be like, okay, so I'm reading this. What is the underlying feeling that I think that they're feeling? Guilt. Then you look down at your answer choices and there's guilt, and you move on. So to make this one a little different about negative polarity, our negative polarity questions are going to have, I don't know why my stuff is on the next slide, but so a negative polarity question is going to be concerned with the false. It's going to be posed as a negative thing. We're looking for the thing that is not true. These types of questions are going to have some words in it that are going to indicate that you are looking for a negative. So you may see except, not, never, contraindicated, further, unacceptable, least, avoid, and these are only just a few. Typically, those words that are that they're going to give you, they may be bolded, they may be caps, they may be underlined, italicized, they may be a combination of a few of those things to let you know you are looking for the statement that is not true. So when you read through these, when you just glance at the question, you automatically see, now you see ROM capitalized, that ain't it, but we see not, and it is capitalized, it is out there, so we automatically know before we even read the question, I'm looking for something that is a negative. It should be something that is affecting a negative thing, something that we should not do, or either a false statement. So on this one, the nurse determines that range of motion exercises should not be done. And remember, we talked about those incomplete stems because we've got that colon there. So we're going to read it like we read the one before. The nurse determines that the range of motion exercises should not be done for comatose patients. Well, no, I think that's a true statement. I think our patients that can't move, we need to move them so that they can stay active. So mark that one off. The nurse determines that range of motion exercises should not be done on limbs that are paralyzed. No, I don't think that's true. I think we should do that. I think that if we read that statement, that we should, I don't think that's right. The nurse determines that range of motion exercise should not be done beyond the point of resistance. Okay. The nurse determines that range of motion exercises should not be done for clients with chronic joint disease. Well, no, we should do that. So the right answer for this one is beyond the point of resistance, because we are looking for, we've got the not, which makes it the negative polarity, and I'm looking for the one that completes this statement. So some preparation tips. You should practice answering questions. So we do our pre-lecture quizzes. You'll do your prep U's, and those are great. And when you're doing those questions and preparing, you need to review the rationale for the questions, even those you get correct. Take some time when you do that first set of pre-lecture quizzes and look through them. And when you look through them, go through and say, like if you get them right or however it's going to work, read through those rationales and see why, because all that is reinforcing. All that does is let you hear it again. So the theory behind it is you graze through the material, do a skim through, read my slides, read the book, however you're going to do to prepare for class. You do the pre-lecture quizzes. So now you've heard all the material twice. You'll hear me lecture it on that Monday. You hear it a third time, and then you do the prep U's and you reinforce it a fourth. So by the time 2 days after class, you have seen that material 4 times. Versus if you don't prepare for the pre-lecture quizzes and you go in and you just take them because it's an assignment. You come to class and you're not totally engaged and you're working on your care plan that you got to do the next day in concepts, and then you rush through the prep U's. You've only heard the material essentially a total of 1 time. Get away now. And you're not nearly as prepared as the person that started learning it and actively learning it ahead of time. So make sure that you take advantage of the rationales, because sometimes in some texts, the rationales will give you reasons why you missed the type of questions. And so that will also be helpful, because if you're struggling with a type of question, then you need to know why you're missing the type. You may understand the concept, you just may not be good at that type of question. Before you take a test, answer questions in groups to build test endurance. Work on, y'all always want to know how many questions is the test. I can tell y'all now, y'all do good until about 50 and then y'all start to fall off. Most of our tests are going to be somewhere between 75 and 100 questions. So no need to ask now. Now you know. You should aim to practice that many questions prior to the test. Sitting down in one session, practicing that many questions. When I prepared for the NCLEX, I knew I was going to take 75 questions and 75 questions only. So I had a piece of paper, I numbered it 1 to 75, and I answered 75 questions without looking at the answers, without checking to see if I got them right. But I answered them in groups of 75, and then I went back through and I saw how many I got right. And if I got 74% of those 75 questions right, then I knew I was ready for my test. So you don't necessarily have to do 75, but you can do them in groups of 20 or groups of 30. To make sure that you are used to sitting down for lengths of period of time and focusing on one thing. We live in a very digital society. So you guys are not quite used to, I mean, you are and you aren't, but used to sitting down and focusing heavy on material. But also that goes back to how you prepare. If you're studying and you're getting the information over 3 weeks instead of slamming it in a week, your retention, your recall is going to be much better than if you study Saturday and Sunday for a test this Monday versus if you started studying 3 weeks when we learned the material. Take your time when you test. Most students are taking about 45 minutes to take a test, or at the most an hour. So if I give a 100 question test and they're taking an hour, they're spending a little under a minute on each question, and they have time left. We don't allow you to go back because in the NCLEX you can't go back. So once you answer that question, it's answered. You can't go back to question 5 once you get to the end of the test. So once you answer the question is answered and we're done. So keep that in mind as well. And then establish your routine when you're preparing for a test. I have some students that like to chew a certain flavor gum, wear a certain scent, drink a certain drink while they're learning their material, and it helps them recall their material. One student did peppermint, and it made the biggest difference in his scores, and he was like, I got to have my peppermint, and he'd have like a handful of them on the desk. Whatever you need to do to help you recall, to get you in a study mood, if it's studying at the same time every day, if it's having the same study routine, if it's studying in blocks where you study for 45 minutes and you move on, whatever you need to do, but get you a good study routine. And some test taking tips. You want to focus on the data in the case study or the question. You want to read every word, especially every word in the stem, and make a decision about what the question is asking. There's a method called rewording, where you read the question and then you try to reword it in a way that you understand it. So if you read the question and then the choices and you still don't feel comfortable with it, you read the question again and then you reword it in a way that you understand, and then approach answering the question again. Make sure that you know the subject. Know the subject of what is being asked. Sometimes you guys assume that it's asking for one thing, and then when you come in my office and we do test review, you're like, oh, I thought it was asking for this, but I see that. If you read the question and you feel like none of these answers are right, absolutely everyone is wrong, you may not know the subject. Sometimes there are distractors in the STEM, and it's going to mention, like let's say for dosage, for example, they're going to tell you some information you don't need to know to answer the question. But y'all are going to focus on that as the subject of the question, and you're going to miss it. So make sure that you know what the question is asking you for. Make sure that you know that they are looking for X, Y, and Z. So go through and make sure you're familiar with what the question is wanting to know. And you guys probably already know this one, but shh, Zuma, hush. Use elimination. When things are not quite clicking, or if it was a concept that you just didn't understand or you didn't study or whatever, go through and eliminate some answers and then make a best choice. And that's okay to do too. If there are questions that says the nurse asked the patient, or the nurse is teaching the patient, or the nurse is talking to a patient, pick whichever answer is most therapeutic. We'll talk about therapeutic communication. I think when you guys listen to the upcoming lecture, but those are going to be answers that are going to focus on the client's thoughts, feelings, concerns, anxieties, and fears. They're not going to be typically answers that are going to be like, tell the patient to get over it, or tell the patient that it's black and white. It's going to be some sort of answer that's going to address whatever kind of concern that the patient brought up, and it's going to be an answer that's going to be a patient-focused answer versus a nurse-focused answer. And as you start to answer more questions, you'll see these types of therapeutic communication questions in all of your classes. So start to learn to pick those up and start to integrate them into when you're studying and you're thinking about patient teaching and talking to patients, that you're picking something that's therapeutic. And then when you guys hit next semester with Ms. Butler and Psych, you'll learn even more about therapeutic communication. Communication. Okay, that is it for today. Take this information as you will. Make sure you listen to me lecture the information for the first week. You can listen to it in bits and pieces or listen to it all at once. And don't forget those things we talked about at the beginning that are going to be due. And I will see you guys tomorrow if you're listening to this on Sunday. Y'all have a great day. All right, guys. Let's talk about what's coming up for the week. This is going to be Module 1. It's going to cover chapters 1, 2, and 4. It's going to talk about the nurse's role in health assessment, what is health assessment, evidence-based practice, the nursing process. While you guys are studying, make sure that you look over the nursing process and be familiar with it. There's several acronyms that you can use to memorize it. That would be a good one to memorize, at least the steps. Look up. We're going to talk about the types of assessments. Health history and interview, therapeutic communication, objective versus subjective data, documentation, and the patient medical record. So this week we're going to focus on the multiple choice question. I'm going to spend about 5 minutes, I'm hoping, just kind of going through the different types and parts of the questions and all of that, just to kind of help you guys as y'all are learning to navigate nursing school. Got a quote for you to kind of give you encouragement through the week. The quote for the week is, hold on, I have it all right here. Okay. Learning is never done without error and defeat. So keep that in mind as you're feeling overwhelmed and learning to navigate nursing. You're new to this and it's okay. There's going to be mistakes. There's going to be tears. There's going to be all the things. My biggest advice is you're going to make some mistakes. Don't wait till it's too far gone to reach out for help. Remember that everyone on faculty has been through nursing school. The majority of the faculty have been through nursing school at Troy. So we are your people to ask versus your peers who are doing it actively with you. Now, your peers may have some tips and tricks that have helped them make changes, but don't be afraid to come and talk to your instructor. Don't be afraid to be an active learner. Y'all like to sit in the back of the class, and then you get distracted. You're on your phones, and you are missing material. Sit up front, be engaged, prepare for class, spread out your learning so you're not trying to do all this at So you're not trying to do all this at one time. So let's get on to the multiple. Go to your room. Go. Sorry, my dog is going through something this morning, and he just wants to be a little whiny baby. Why is my... Okay, so let's talk about understanding the parts of a multiple choice question. The slide that's not showing up tells you what each part is. So we've got the stem, which is going to be the question part. We've got your options, and then within the options, there's two types of those. We've got the correct one, which is going to be your correct answer, and then the others are called distractors, the ones that are not correct. So when we look at questions, we either have a complete or an incomplete stem. The complete stem is going to have it's going to be a statement all of its own. So this one says, which is the most common reason why older adults become incontinent of urine? Well, that question we should be able to answer if we have, if we're familiar with the material, we should be able to answer it before looking at the choices. If you see a question like this, it's a good idea to start answering it before you read all the choices and pick the choice that matches what you were thinking, especially if you have prepared for the material. We have incomplete stems. So notice how this one ends in a colon. It may end without any punctuation. It may, your teacher may draw a line. It may have ... It may have a semicolon, but whatever it is, it's not a complete statement. With these, you're going to have to read each answer choice to decide what is right. So this one says the most important reason why nurses should teach people not to smoke in bed is because it can. So when I see a question like this, I'm going to read my stem and I'm going to read each answer choice with it. So I'm going to say the most important reason why nurses should teach people not to smoke in bed is because it can upset a family member. Okay. The most important reason why nurses should teach people not to smoke in bed is because it can precipitate lung cancer. And I'm going to do that for each one of those. But as I'm reading it, I'm picking up on something. I'm picking up that phrase, most important. So when I see most important, most right, top priority, that's letting me know off top, probably all of these answers are correct. But which one is most correct, most important, most relevant to what my patient has going on now? So I know my patient's in the bed. What is going to be most important to them while they are in the bed? Starting a fire. So you'll learn to kind of break those questions down, but look for those keywords that help you decide what you need to be doing for the question. Some questions are going to have positive polarity. They're going to be focused on the truth. So when we look at this question, we see at the very end, before we even read it, it's got a question mark at the end. So that means that should be a question we can cover up those answers and answer without reading all the choices. An older adult who is dying starts to cry and says, I was always concerned about myself first, and I hurt many people during my life. Which is the underlying feeling being expressed by the client? Well, if I read that, I'm going to be thinking, okay, they're feeling guilty. I'm going to cover my answers, and boom, there it is. We are focused on the truth. Then we have negative polarity questions. These questions are going to are going to have some keywords in it that are going to tell us that we are looking for the thing that should not be done or should be avoided or whatever. And it's going to have keywords like except, not, never, contraindicated, further, unacceptable, least, and avoid. And there's a lot more, but these are the common ones. Those words, when you see them in a sentence, are going to be capitalized, all caps, bolded, underlined, italics, something to let you guys know that we're looking for the thing that should not be done, or the thing, all of these should be done except, or you should never, or this is contraindicated. So when you read these choices, that means all of the other choices are likely correct, and the one I'm looking for is the wrong one. So the nurse determines that range of motion exercises should not be done. And so this one is an incomplete because I see my colon, and I am going to have to read each of these answer choices with my stem. So the nurse determines that the range of motion exercises should not be done for comatose patients. Well, that's not a true statement. We should do it. Let's read it again. The nurse determines that range of motion exercises should not be done on limbs that are paralyzed. Well, that's not a true statement. We should be doing it. The nurse determines that range of motion exercises should not be done beyond the point of resistance. Okay, well, that makes sense. So when you see these types of questions, I'm looking for the one that makes my whole statement true. Even though it's a negative polarity question, that means it's just focusing on something we should not be doing to our patient. Some preparation tips. Practice answering questions. So we're doing that. We're ingraining that into your assignments. You got the pre-lecture quizzes, the prep use. When you guys are studying for a test, for sure study them. Shh. Sorry, that is my dog. Stop it. You for sure should be studying the material, but you need to test your knowledge and understanding of the material. And then while you're doing that, read those rationales. And of course, when I can see when you guys go through and answer questions, but I can also see how many of you guys are doing those reviews, or if you get them wrong, you're going back to the book to reinforce the material. Review the rationale for the questions, even those that you do not get correct. So if you don't get it right, or even if you do get it right, but you just felt like you just guessed and you fluked upon it, go back to the text, or go back if it's got the rationales listed in a different way, and read those rationales. The Saunders, if you guys are looking for a good book to take with you all throughout the nursing school, and I'll show y'all the book when we get to class. The Saunders NCLEX RN is a great book because it's going to tell you the rationale for why the question answer is what it is, and it's also going to give you a test taking tip for that particular style of question. Prior to your test, answer questions in groups to build test endurance. Y'all are used to answering questions in groups of 5 or 10, and then you get to the test and you are overwhelmed because we have 75 to 100 questions on that test. You've got to build up test endurance. You've got to start practicing answering more questions that cover multiple topics, and sitting down and carving out 45 minutes, 30 minutes of your day when you're prepping for your test to answer those questions, and answer them all, and then go back and read the rationales and see how many you got right. If you're answering questions 20, 30 at a time, do the math and see how many you have to get right to be a 74. And if you are consistently getting 74% of your practice questions right, then you're probably in good standing for the test, especially if you've got questions that cover multiple areas. Take your time when testing. Each of our tests, like I said before, will be 75 to 100 questions. So make sure that you take your time. Most of you last semester, they were finishing pretty quickly. And we can see when they go through and answer questions that they tire out. You guys don't typically like the longer test, but it's to prepare you for the NCLEX, because the NCLEX doesn't care if you're tired or not. It's going to be 75 to 300 something questions. So you don't know how many you're getting. So we need to prepare you guys for that. Establish a routine when you're preparing. So you're going to drink the same beverage, chew the same gum, or even wear the same scent when you're practicing. This has been studying. This has been shown to kind of trigger memories and recall. You can do a peppermint. You can do lavender. You can do lemon, whatever you like. Those are typically scents that help with recall. Ginger, or eat a Hershey bar, or whatever it is that you like to do, and get you a good study routine and a preparation routine. No, that's not the last test question. That's not the last slide. Okay, and so the last tip, I don't know why it's not showing up, but the test taking tips. You want to focus on the data. You want to focus on the data in the case study and the question, and read every word of the stem especially, and make a decision about what the question is asking. If you read that stem of the question and you do not understand it, or you feel like you're not finding a choice that's applicable, reword it. Go back through and take that information, reword it in a way you better understand it, and then look for your answer. Know what the question is asking, know the subject. Sometimes the stem itself has distractors that are meant to throw you off, or just random things in there, information that you don't need. Go in and make sure that there's none of that. Remove that, and then know what you're looking for. You guys probably already do this, but use elimination. Go in and mark off the answers that you know for sure are not correct. Like if you read an answer and it's just absolutely balls to the walls crazy, go back in and remove those. Therapeutic communication. You want to use therapeutic communications to answer communication questions. So if it's like the nurse is talking to a patient and blah, 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 you want to use things that are going to be that are going to focus on the patient or the client's thoughts, feelings, concerns, and anxieties and fears. Whatever the answer is needs to focus on what the patient was concerned about. Also, don't choose a choice that's going to just pacify your patient. So we don't like things that say, oh, it's going to be all right, or, everybody goes through this. We want answers that are very specific. And as you guys listen to the lecture upcoming, it'll talk about therapeutic communication and kind of how to look for it, and we'll be practicing it all throughout the semester. If you guys are listening to this on Sunday, January the 7th, I'll see y'all guys tomorrow afternoon. If you're not, then I'll see y'all when I see y'all. Have a good day.